Good afternoon and welcome to the St. Clair County EMA Daily COVID Briefing. I'm joined by County Board Chairman Mark Kern, and Samantha Bierman's back with us today to provide the Health Department report. Sam, thanks for joining us.
Absolutely. Thank you for having us. As of today, 36,208 St. Clair County residents have been tested for COVID-19, which is an increase of 657 from yesterday. And we are at 3,907 positive test results, which is an increase of 45 from yesterday. And that does include both males and females from their teens up to their 70s. And today our county positivity rate is 6.8%, which is a great number. Right now we are at 32,301 negative test results, and we are still at 154 deaths, so we have no new additions in that category. For those who have completed their IDPH required 14-day quarantine, we are at 2,899. For state totals, we are at 2,778,322 that have been tested, with 181,943 positive test results, which is an increase of 1,467 from yesterday. And for deaths, the state is reporting 7,517, which is an increase of 14 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, currently we have 46 patients that are admitted due to COVID-related reasons, and one of those patients is on a ventilator. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, I am happy to report that we have no new additions to cases or deaths, so that's always a great day for any of our long-term care facilities or congregate living facilities. And now I will turn it over to Chairman Kern for his update.
Thanks, Sam. So once again, 29 out of 45 today are under 40.
Yes. We're starting to see a consistent trend in that age group.
So we'll just have to continue to get the word out.
Yes.
Try to let people know that that people of all ages
Exactly.
are affected by COVID. So today's our question and answer day, but we're going to move into the zip code report right now. In 62059, we remain at 11 COVID positive cases diagnosed. In 62201, we went up by 1 to 185. In 62203, we remained the same at 151. 62204 remains the same at 115. 62205 goes up by 1 to 148. 62206 goes up by 2 to 339. 62207 remains the same at 201. 62208 goes up by 4 to 249. 62220 goes up by 5 today to 324. 62221 goes up by 8 to 347. 62223 goes up by 5 to 173. 62225 remains the same at 16. 62226 goes up by 5 today to 409. 62232 stays the same at 83. 62239 stays the same at 46. And 62240 remains static at 14. 62243 likewise remains the same at 26. 62254 goes up by 1 to 120. 62255 remains the same at 13. 62257 remains the same at 22. 62258 goes up by 2 today to 61. 62260 goes up by 4 to 49. 62264 remains the same at 68. 62269 goes up by 4 to 275, and 62285 remains the same today at 37. Brian, are we ready to start the question-answer phase of this?
We are. We have quite a few questions, a lot of health department related questions. Sam wasn't able to join us last Sunday, so we have some of those that were left that kind of play a little part in some of today's questions, so we'll try and get through a lot of them, but definitely a lot of health department questions today. Some that we've answered before, but we'll try and get some clarification on some questions. So.
Okay.
Sam, the first one is, we would like to know if veterinarians and their staff should be required to wear masks while handling and examining pets. We have called several clinics in the area, and most admit that the veterinarian does not wear a mask while performing the procedures. How likely is a human going to pass COVID-19 to a pet and then in turn the pet carry it home?
So based on the current guidance from the CDC, at this time there is no evidence that animals play a significant role in spreading the virus. The risk that animals of spreading COVID-19 to humans is relatively low. Now, with that being said, if there is no other person in the room, there's no need for a veterinarian to wear a mask if they are alone in the room. However, if there are multiple people, as we've said, in a room closer than 6 feet, and that they're going to be in that close proximity for more than 15 minutes, we always recommend that you do wear a mask.
Okay. Next one, a question we've talked about a lot. Is it recommended by the IDPH for individuals to be tested multiple times?
Currently, there is no guidance from IDPH or the CDC on that. However, it could be situationally dependent. Sometimes there are employers that, as a condition of employment, might require an employee to have multiple tests, or depending on the type of field you work in. Some of our first responders that potentially might be exposed time after time, police, fire, EMS. So it would be situationally dependent, but as of right now, there is no guidance out from IDPH on that matter.
Okay. The next one says, if an employer requires a negative test for a new hire, but some testing sites have taken up to 13 days to get results, how can that employer be assured the new hire is COVID-free and has not been exposed during the waiting period?
So if an employer does require you to have a COVID test before you start employment, it is best to let them know, whatever facility you go to, what the approximate wait time for your result might be. And then the only way to guarantee, if it does take 13 days from the time you were tested, is to quarantine at home away from others in your household to guarantee that you have had no further exposure or potential exposure to anyone that could be in your house that potentially could be positive. So quarantining after you take your test and staying in that quarantine until you get your test result.
So stay there until it comes.
Exactly.
And we have seen this week with some of the modifications that have happened here in St. Clair County, a little quicker turnaround time.
Mm-hmm.
Got a lot of good response from the IDPH testing that's been going on all this week, happening again today until about 4 o'clock at Belleville East. We've seen about 48-hour turnaround on those.
Yes, and and we understand that the labs are working as hard as they can. They're open 7 days a week, and there's only so many tests they can run with so many hours in the day. So we certainly appreciate all of their help with turning those test results around in a quicker time frame.
Okay. The next one says, do any of our hospitals use remdesivir or plasma for treatments? I remember early on that one of the hospital guests said they were not. Has anything changed?
So our hospitals in St. Clair County have received remdesivir. The allotments for that medication have been determined by IDPH, and for the individuals that it's been used for, it's been looked at on a case-by-case basis depending on the patient.
But it is now available to,
Correct, yes.
to every hospital in our county.
Yes.
Okay. One more here real quick. It says, St. Louis provides number for patients that have recovered from the virus. Will the county ever have a number of recovered patients?
So yes, we do give that number every day. And today, for those that completed their IDPH required 14-day quarantine, we are at 2,899. So when we do that number, that's what we are considering recovered because they have completed their 14-day quarantine as required by the state.
But and I think we've talked about this before. The reason we don't call it recovered is because obviously there are various stages of recovery.
Yes.
As we've heard from some of the guests on this briefing, Mr. Anderson is still going through surgeries due to side effects from being on the ventilator. And
everyone is different. If you had previous medical conditions before you got sick with COVID, that could have exacerbated those medical conditions. So the length of time that it takes me to recover might take you longer or vice versa. So it's very hard to put a definite time frame on recovered. So that's why we use it as those who have completed the quarantine period.
very good, thank you. Chairman, I'll give you a couple that came in here that you can have some input on. First one says, who makes the decision to tighten up restrictions and why has that not happened yet, regardless of regional numbers?
So the state of Illinois are the ones that put the regional numbers together and actually formed the region, St. Clair, Madison, Monroe, Washington, Clinton counties. And they're the ones that make the decision with that 8% regional number over 3 days. And there are other metrics that can have you move backward. And the logic behind that and the science behind that is that we need to do this on a regional level. It can't just be one specific small area that makes changes. It has to be a broad geographic section of the state. Otherwise, people will just go from one area to the other and then do their business, whatever you're moving back on. If it's a restaurant or a bar, they'll just move to the most convenient nearby geographic location, and then they'll have the same bad habits there. They'll bring that back to wherever you've stopped serving, and so it really doesn't serve any purpose. So that's why they do a broad geographic location. It's the state who decides those numbers, and that's the reasoning behind that.
Okay, thank you. And kind of on that same topic, the person wrote, why are the regional metrics not updated every day?
So the metrics are updated every day, but the state is using a 3-day running average. So they update every day. It's just that there's a lag in days because they're 3 days behind. So, but every day you do get a new number. It's just it's a 3-day lag on that particular number. Luckily today, once again, our numbers remain below that 8% level. So having that 3-day average is working in our favor right now. But we're out there, we're trying to enforce the code. I know the Sheriff's Department was out this weekend checking on compliance in a number of locations. Sheriff Watson takes this very seriously, and as do we, that we've got to try to get people to comply. We're finding that bars are mostly complying, but there are places where they are not, and so those are the ones that we need to work on. We need to talk to those owners, make sure they understand what they need to do, and that's where we are right now.
Okay, thank you. Sam, a couple more health department questions that have come in. The next person writes, does the health department suggest those who have tested positive to retest after 14 days? This question stems from Shelley, who was on the briefing yesterday and is definitely still exhibiting the cough, but was told her quarantine period is over. She stated she felt unsure as to whether she may still be contagious.
Sure. And for anyone that does have any questions, please don't ever hesitate to ask any questions of your contact tracer when you're on the phone with them. And then even after you're done, if anything ever comes up, sometimes when we need those questions to pop into our head, they aren't there. But don't ever hesitate to reach back out if you think of any questions after you're on the phone with your contact tracer. But there are 2 ways that we can determine someone coming off of quarantine, and that is test-based and symptom-based. And as we talked about previously, it depends on the person and what underlying health conditions they may have had previously and what the current guidance is. IDPH guidance on COVID-19 is always evolving, it's always changing. And so the most recent guidance is that you can return after you are 24 hours fever-free without the use of medication from your quarantine period. That used to be 72 hours, and that encompassed all the symptoms. Well, IDPH has updated that guidance and is now down to 24 hours without a fever only and without the use of medication. So we look at it on a case-by-case individual basis.
Okay, thank you. Next person wrote another question about the recovery numbers. I think we've talked about that we announce that each day.
Yes.
The next one then would be, can you please explain why if one person in your household tests positive, then the department or doctors just advise that the rest of the household should quarantine and only test if they develop symptoms? I thought they could be carriers. Also, how long would their quarantine be? Is it 10 days? Is it 2 weeks? Is it from the test or from the start of symptoms? They've heard conflicting reports. So can you kind of talk through that quarantine process?
Sure. And that's why our contact tracers and our contact tracing system is so important. So when an individual does have a confirmed COVID test result, we're going to call that individual. We're going to find out, number one, how they're feeling, and we're also going to find out who is in the house with them, as well as who they had been exposed to before they became symptomatic and or before they were tested. So what we will do, let's say in my household, maybe I have 3 other people living in the house with me and I'm the positive one. So I would have a 10-day quarantine period. The other individuals in my house would have a 14-day quarantine period. And a lot of times we get questions, well, why is one 10 days and one is 14? That additional 4 days is built in for those who were exposed as an incubation time frame period. Because when I was tested, I may have not been symptomatic and had essentially been incubating before any symptoms came about. So we're building in that time frame to help limit the exposure to any other individuals.
And then if they develop symptoms during their isolation, they then have a 10-day quarantine.
Exactly. So, and that's why we have to look at each one of these cases on its own individual merit. And depending on the size of the household and the dynamic within the household, it can be quite tough on the brain to figure out, who has what quarantine period. And, if it's an exposure issue for a relative within the house or even a relative outside of the house, it's 14 days from the last exposure. So if one of my family members was exposed to me and then I came back positive, they have 14 days from the last time they saw me. So it's really hard to say this is a blanket explanation because each case is so individualized, and that's why our contact tracing process is so important.
Okay. One other question here for you real quick. It says, I heard that Memorial East transfers all COVID patients to Belleville. If that is true, then all of these patients are only at 3 of our hospitals. Wouldn't that be a lot of burden on the staff at the hospitals?
So our hospitals have made decisions based on several factors: staff, resources, bed availability, and what works best for, a potential surge of COVID positive patients. And many hospitals that are in networks make that decision to say, this is going to be our COVID hospital. We're seeing that in our area, and we've seen it in some of our other outlying surrounding counties as well, that they are designating a COVID hospital.
So it's not uncommon to see those being admitted for COVID in the Memorial Network are being admitted at Belleville Memorial.
Correct, yes, because that's where they have the space and they have more staff and resources to adequately keep COVID contained in one area.
I believe we had Mr. McManus from Belleville Memorial on here before, the president, and he came and referenced that and said they were able to establish a set wing at that hospital that was nothing but COVID. So it provided for that safer environment, able to keep the same staff dealing with COVID patients. And they actually made a decision when they did that, they moved their OB department from Belleville to Memorial East to keep all of the OB patients out of the hospital that was dealing with COVID.
And especially for smaller hospitals that might be in a bigger network where, they might not have an ICU in that hospital. So that's why they designate a specific hospital to send COVID patients to where they have the most resources available.
Okay, thank you. Chairman, a couple more that came in for you. This person writes, if a customer refuses to wear a mask in a business and the business asks them to leave but the customer refuses, can the business call the police?
The business should be allowed and would be allowed to call the police. The police should arrive and have that person removed.
Okay. The next one says, what exactly are the consequences for St. Clair County if we continue at our current COVID-19 numbers? Will it be just St. Clair County lockdown, or will it be more of the region, kind of like you talked about a little bit ago?
So, we're making an effort along with the mayors, the municipalities, other government officials to take a look at where we stand right now. And our numbers are too high. We know that in St. Clair County. We tend to be above that 8% level, although today we were below it, which is a good thing. So we want to try to get below that so that we're not the county that brings all those other counties in the region to the 8% level. The only way we can do that is to get out there, talk to businesses, and the chambers of commerce have been really great everybody's been great. And we find when we tell most of the businesses, hey, this server wasn't wearing a mask. Can you make sure that they do? Can you make some changes? They're always amenable to that, and people really want to pitch in and help, because if we don't all pitch in and help, then we're going to get to that number we don't want to get to, and we're all going to have to go back. So wear the masks, wash the hands, and watch the social distancing are all things that we're out there pitching, and it seems to be well received. And I think most people are trying, and we just need to continue to do that so that we don't reach those levels. But if it happens, it won't just be St. Clair County, it will be on a regional basis.
Well, Chairman, I think something important when we talk about those regional metrics, the region is based on the hospital regions. So we have about 8 counties in this hospital region that we participate in. And I think it's important to note in there that some of those counties don't have their own hospital, so they rely on St. Clair County hospitals to have resources available for patients of their county. And that's why it's so important for us as a region to respond to this, because if St. Clair County is overwhelmed and our hospitals would become overwhelmed, we're also affecting surrounding counties that don't have their own hospitals.
And this virus doesn't know geographic boundaries. So there were, a few weeks ago, we had an incident where there were some party buses that came from a neighboring county, came to St. Clair County. The person on the bus, on a couple of the buses, had COVID, and it causes a problem. It spreads. It goes beyond geographic locations, and the goal here is to try to keep those numbers down, to keep the spread down, and that's why the restrictions are in place.
Thank you. Sam, we'll go back to you with a couple more health department questions here. The next person writes, can you please stress the proper way to wear a mask? I see too many people that pull it down under their nose.
Yes. So as we've done a couple times, we've done demonstrations before, but when you wear a mask, it's always important to make sure that it not only covers your mouth, but your nose as well. So when you have your mask on, you want to make sure that it's extended on probably about the middle of the bridge of your nose, and then goes all the way down to at least your chin, because we want any particulate matter, if you were to cough or to sneeze, to be contained in that mask. So that's why we don't want them too loose, and it should cover completely your mouth and your nose. And I know we live in Illinois, and it's now July, and we have a lot of humid weather, and it's hot, and they're not comfortable, but it is one of our best ways to keep the spread of COVID-19 low, is to wear it correctly, covering both your mouth and your nose.
Okay. Kind of another question here on the topic of face masks. It says, if the numbers of positive cases keep increasing, why aren't our EMS crews for local agencies wearing masks when conducting patient care or going in and out of hospitals? This is a first-hand account, as I work in EMS, and I have seen this behavior.
Mm-hmm. So any first responder, whether it be police, fire, EMS, has the same requirements to wear a mask, when out in public, if you can't maintain that distance. And all of our local EMS providers in St. Clair County have been provided by EMA, and the PPE that we've received from the state, those companies have been provided PPE to pass along to all of their staff. So police, fire, EMS, when dealing with emergencies with the public.
Okay. The next person says, would you please explain what is meant by a 3 or 7 day rolling average?
So this is the average of the previous 3-day period or previous 7-day period, simply depending on which metric we're looking at. So it's just an average of a 3-day set of numbers or an average of a 7-day set of numbers.
Okay. The next one says, is Team St. Clair going to start wearing goggles along with masks now that Dr. Fauci recommended wearing them to stop the spread of COVID?
Well, I'm sure most everyone has probably seen the article or seen an interview regarding that. At this point, IDPH and CDC have not changed any of the guidance that they have out there, stating that you need to add any type of eyewear protection along with the mask. So at this point, we will just be continuing to wear our masks. And if that guidance changes, then we will certainly follow suit with whatever is recommended.
Because goggles, unlike the masks are designed so that you're not shedding this virus to other people. Goggles really protect you from people who aren't wearing those masks.
Correct,
So,
yes.
So we're going to continue with the mask because we don't, we want to make sure that this virus isn't shed to anyone else. As far as goggles in the future, if people feel particularly vulnerable or they feel they're going to be in a vulnerable situation, then they should.
Absolutely. You're certainly welcome to take any above and beyond steps that, you feel necessary to keep yourself safe. And what I think people forget sometimes is by wearing a mask, it's more for those around you for when you're wearing a mask than it is for you. You are trying to protect others from anything that you might have and vice versa. I think sometimes we forget that.
Well, and as we talk through all this, those that are in those vulnerable situations, our first responders, police, fire, EMS, we've provided them with goggles that were given to us by IEMA in order to make sure that if they're in a position where a patient could be aerosoling droplets towards them, they do have goggles, face mask, face covering, isolation gowns, various different things to help protect them, because that's different than just two people walking by each other in a store or sitting having a conversation.
And with that's a very good point. All of our first responders, not only aerosol generating procedures, but we're talking firemen and police who might be helping out at the scene of an accident. There's people, when you start to move and your heart rate goes up, you just naturally start to breathe harder, even in situations like that. So we are certainly appreciative to the state for providing all of the PPE that they have given EMA to be able to disperse out to our local emergency first responders.
Okay. Another one says, is it safe for me to eat outside by myself during COVID-19?
Yes, absolutely. If you can find one of the nice days that's not too terribly humid, yes, we certainly suggest going out there and getting some of that vitamin D and helping recharge the batteries.
All right, and Sam, one last health department question says, does IDPH have a document that they mail or email to show a person tested negative? My daughter has to test within 7 days of her arrival at college, and they want a document indicating the negative. I have not heard of anyone getting anything other than a phone call.
So most facilities, when you are tested there, they will give you a phone call with your test results. I do know that Walgreens in Cahokia, not only will you get a phone call, but you can either choose between a letter or an email. But if you are needing a physical copy of your test results, it's best to call the location that you're tested, let them know why you're needing a copy of your test results, and they can accommodate you. And if for some reason they aren't able to, please don't hesitate to reach out to us at the health department. We'll do all that we can to put you in contact with someone who can get you a copy of your test result.
Well, Sam, thank you for providing that information and
Absolutely.
and being here on behalf of the health department to answer some of these concerning questions. Because as COVID changes daily,
Questions change.
So does the mind thought of us, of the followers, just wanting that kind of reassurance that they're doing it the right way, because most don't want to spread this virus onto others.
Exactly. Most of our residents in St. Clair County have been very responsible and very caring about other residents that are around them, wanting to step on this and get back to normal as quick as we can.
All right, Chairman, I got
Thanks, Sam.
one more question here that came in for you, and it says, does the county plan to roll back to prior than Phase 4 restrictions or put changes in place to combat the increases in cases?
So, enforcing the rules and the regulations that are currently on the books are, I think, enough to keep us from having to go back. There are square footage requirements that places have to follow. Retail establishments, bars, restaurants are required to follow. Face coverings, those type of issues. And the health department is working with the county, with all the municipalities, and not only our health department, but the Eastside Health Department are working in concert to try to use the regulations, the rules that are currently in place to make sure that this spread doesn't happen. If we continue to do that, we think we can keep the numbers where they are and we won't have to roll back. But if the numbers grow and people don't get the message on wearing masks and washing hands and staying 6 feet apart, and we do have continued growth in the spread of COVID, then we may have to roll back, but that will be, as we've said, on a regional basis, according to the state of Illinois and their numbers, and that'll happen with 3 days of 8%, or with hospitalization numbers or other metrics that may happen. So let's hope that we continue to do what we need to do to stay where we are as far as being open.
Thank you. We're joined by the St. Clair County Regional Superintendent of Schools, Susan Sarfati. Susan's been instrumental in having many of the superintendents on these briefings to discuss their plans of how their schools will reopen. Some have been remote learning, some have been in-person learning. And Susan, we had a few questions come in that we'd like to talk about, and then we'll hear who you got lined up for us next week.
Okay.
The first person wrote, what can be done in the county to cause school leaders to back off of in-person learning with the high numbers that we're having?
Well, the decisions on whether to have school in person, have a blended plan, or to be completely remote are based on, first of all, what is happening and what we're told from IDPH with our county and our region, and just as we've been talking about for the last half hour and the last week after week after week. But it is based on the numbers, and it's based on what the parents are requesting of a district as well. That plays into their decision.
Okay. The next person wrote, what is your opinion on schools opening up? And did the school districts work with your office to develop their plans?
Well, my opinion is we've listened to all the experts, the national experts and the local experts who talk about the best thing for kids is to be in person in school. But we also know that the most important thing is that we keep our children safe. We keep them safe mentally, emotionally, but also physically. So the decision on whether or not to do this is not an easy one. And our superintendents and the teams that they've been working with within their school, that includes parents and teachers, is a very difficult one, and they've wrestled with that. As far as the role that the regional office has, we've been sharing information. We've been working with the state board and with their large group of stakeholders with what's called a SWAT team of people that are made up of all different superintendents, principals, teachers associations. And so I help our districts know and understand the rules and regulations and answer questions as best I can.
Well, I think it's important to note that the health department also has a liaison that works directly with all of the school districts to answer any questions and concerns they may have.
And I can't tell you how often I've heard the superintendent say to me, oh, I've talked to Barb at the health department, or I've talked to Sam, or I've talked to different people, and they told me how to do this. So they looked at our plan. The health department has been willing to look at any school plan and give their opinion and suggestions. So the health department has done a fantastic job with our schools.
Well, and as we've heard from the close to a dozen superintendents that have been on, and another week's worth coming up here this week, there are no two school districts in this county that are identical. It could be a different population, it could be different building sizes, different accommodations that are available, and different needs of the individual students, that we really can't come up with a county plan and make it 100% perfect for everyone.
Absolutely. St. Clair County is a perfect microcosm of the state. We have urban, we have rural, we have small districts as small as 80. We have our largest district, it has almost 6,000 students. So we see every combination that you can possibly see in a school district. And you're right, it looks very different in East St. Louis compared to Marissa, which are our two farthest extremes in our county. And we have to do it, that each superintendent has to do what's best for their own school district. One size does not fit all.
Well, and we definitely thank you and your staff and all the superintendents, principals, the teachers, the paraprofessionals, all the way down to the parents, as this is a process that is stressful on everyone and is not something that anybody is making decisions lightly. And we just thank them all for their efforts, thank them for taking the steps to try and make sure our students are safe and put in the best environment as possible. So with that being said, who do we get to hear from next week?
Well, first of all, you're absolutely right. Teachers have been learning things. I have some teacher friends, and they've said that they have learned more these last few months than they ever thought they would in a very short period of time. And superintendents and principals are fielding questions right and left. So it is a stressful time. But we do have 5 more superintendents. On Monday, we'll be having Matt Steins from Grant Illini School District 110. On Tuesday, Dave Dietz from Harmony MG 175. On Wednesday, Carrie Ruby from O'Fallon District 90, that's the grade school district. On Thursday, Arnett Harvey from Cahokia School District 187. And on Friday, Greg Fairking from Freeburg High School District 77.
Well, Susan, thank you for working with these districts and arranging them to be here on the briefings. We hear from the followers every day that they're looking for more and more answers, and we always like to refer them to those school districts to get their specific questions answered. But it's great when we can bring them here to have their questions answered in person by the superintendent and put them on a platform for a lot of their district to be able to hear that.
And this is very fluid. What a superintendent may say on Wednesday could change by Thursday. So just remember to be flexible, be patient, and we'll do our best to give you the best up-to-date information we can.
Well, thank you for joining us again, as you do very frequently. We thank you for joining us. We like to do these question and answer sessions on Sundays to answer as many of the questions as we can. I'm sure there are more questions in the Facebook feed that we will review and get you the answers to those questions as quickly as possible. We will continue with these daily briefings as long as the information is necessary to be provided, and we thank you for joining us and helping spread that message that we all need to wash our hands, watch our social distancing, and wear the face covering. We'll be back with you tomorrow at approximately 3:30 with our next daily briefing, and we'll be back to you here shortly for the translation to our Spanish-speaking community. Thank you.